Dr. Curtis, how do you explain atrial fibrillation to your patients?
Well, atrial fibrillation is an irregular rhythm that starts in the top chambers of the heart. So the heart has an actual normal pacemaker at the top of it. Generally speaking, in most patients, if they're not exercising, there's an impulse, an electrical impulse that comes out 60 to 100 times a minute. It causes the top chambers, which are called the atria, to beat in a regular fashion, and then the impulse travels down to the bottom chambers, the ventricles, and then they'll beat in a normal fashion, and then blood flow goes out to the body. When you have atrial fibrillation, instead of that normal pacemaker firing, the top chambers, the atria, start firing really erratically. And they get very irregular in the way they do, very rapid, and you lose that organized contraction to the top chambers. Then what happens is as those impulses go to the bottom, the ventricles also tend to beat in a rapid, irregular fashion. How would you explain atrial fibrillation to your patients?
I explain quite a similar way, and I also try and tell them how common it is in a population where hundreds of thousands of people in the world have atrial fibrillation. It's more common with aging. By age 80, just about 10 to 20% of the population have atrial fibrillation. It's one of the most common arrhythmia in the world. And it may not be a life-threatening arrhythmia right off the bat, but it could cause various symptoms and also stroke. So it's very important to discuss this with your doctor.